Speech Recognition Advancement in Healthcare and its Future. The speaker for the session is Mr. Rustom Lawyer, co-founder and CEO Cognito.
Great pleasure to be speaking at CAHOTECH today, and good evening to everyone. Really looking forward to actually talking about this very exciting and sort of emerging field of voice artificial intelligence. And the way we like to really look at it is the VUI, which is the voice user interface, and why this is becoming, the next leap in healthcare according to us. So I'm really going to take you through three use cases, clinical speech recognition, or medical voice assistant, and voice diagnostics. So firstly, why do we need clinical speech recognition, right? As we had said, in the sort of adoption of EMR, one of the biggest sort of pain points really is that, doctors spend maybe 40% of their time, trying to actually fill up these type of systems. There's studies in America and stuff saying 3 hours, 3.5 hours a day is going on this, right? And, I think, if we're going to be sort of getting into, proper EMR adoption across India, right, I think it's very, very important to try and, get these type of technologies integrated right at the beginning, to boost your efficiency, by, 4 to 5x really. And this is really across the continuum of care. You can actually integrate it into all these sort of specialities, and we're going to talk about that a little bit later on in the presentation. But I think another very, very important point is, again, there's studies by Johns Hopkins that about 250,000 people die every year because of clinical error, right? And, I think Dr. Kedar was saying 60% of medication errors happen because of poor handwriting, right? So, that's bound to be a very big number here as well. And we believe that if you actually try and improve documentation, this is actually going to improve communication between doctors, and this is going to reduce these type of errors quite substantially. So that's why I believe it's a very strong use case and should start getting integrated into the EMR landscape. Another very interesting area is the sort of future-facing, area of a medical voice assistant. So, you can think of it a little bit like an Alexa, but I think it's a lot more sort of sophisticated and very focused in this, in this area. So you could imagine that a doctor-patient conversation happening, and you're able to actually pick out, the relevant information from that conversation and actually update structured information into an EMR, right? And what is this going to achieve, right? This is simply going to achieve, the ability to focus on the patient, right? To have that eye-to-eye contact, right? And instead of looking at a screen, which today, when you have an EMR, a lot of that happens. Obviously, it will reduce fatigue. And, at the end of the day, all this is going to improve your structured information and better analytics as well. So, I'll take you on to another very interesting area, which is the area of voice diagnostics. Or, you can talk about the area of voice biomarkers. So actually, a voice biomarker is really a technique to detect disease by using speech or understanding speech characteristics, right? I'll give you a little story. Like, for example, if you're away on a work trip and you speak to your mother or you speak to your wife, within a few seconds they're going to be able to tell you that you're tired or you're stressed. That is simply a voice biomarker. And I think our deep learning technologies are becoming very, very good at this. And there's a lot of papers really that are showing very promising results for early detection of Alzheimer's disease, pulmonary disease. There's an emerging area in mental health as well, right? So you could imagine that someone who's depressed or someone who's schizophrenic, the tone of their voice, the speed of their voice, all these characteristics, can be actually looked at and give extremely good results. And another very interesting area is, in actual COVID detection. And there's several, papers that have come out all over the world, which are showing very good results in being able to actually detect if a person is COVID positive. So that's pretty amazing, actually, as a tool, to diagnose things. So I'm going to sort of take you down to what Ognito really focuses on, which is the speech recognition to really drive your EMR adoption, right? So, it's very clear that it's 4 times faster than typing, right? And you can imagine the type of efficiency gain that can give, right? Another amazing thing is that, if you dictate the word, you're going to have absolutely 0 spelling mistakes. So that completely removes that area. And, we've done studies here at Ognito, with some of the largest, sort of healthcare organizations. And if this is actually put through the proper continuum of care, and it's actually put into all the clinical applications, you can boost efficiency so much that you can actually add something like 20 crores to the bottom line. And that's some of the modeling that we've seen. And, at the end of the day, you can get much better and more accurate patient reports. So I actually wanted to take you through a small video, which actually shows, how our speech recognition engine, which has actually been developed over nearly 8 years, working with, professors from MIT, Sheffield University, IIT Bombay, to develop an engine that can really work across specialities. I think most people, consider speech recognition in the radiology sector, right? But I want to show you the other specialities, where we are actually creating a lot of efficiency. So I will just put that on.
Cardiology assessment report. Header last line. New paragraph. The patient had initial echocardiogram that demonstrated impaired left ventricular function with an estimated ejection fraction between 40% and 50%, with evidence of fluid overload that responded to low-dose furosemide, full stop. Pre-discharge, she had further echocardiography which demonstrated an ejection fraction of 50%, with more dynamic systolic function at recovery, suggesting a degree of impairment related to COVID-19, full stop. Home, the patient is gradually improving in fitness, full stop. She has really had to start from the beginning, both in terms of mobilization and her exercise capacity is gradually improving, although she is still short of breath, full stop. General surgery report. Header last line. New paragraph. The patient's endoscopy in October 2019 demonstrated a 4 centimeter hiatus hernia and grade 1 esophagitis in the lower esophagus with moderate erosive gastritis in the stomach, full stop. More recently, in June this year, she underwent esophageal motility and pH studies, full stop. The conclusion of report identified normal esophageal motility with 1-2 centimeter hiatus hernia, normal exposure to acid reflux, full stop. Specifically, there was an acid exposure time of 6.1% in the upright position and 0% in supine position, giving a normal total acid exposure of 2.3%, full stop.
So I'll probably stop there. I mean, I had another report, which is the oncology assessment as well, but really wanted to show that, today it's a very, very advanced system. You can see that all the sort of detailing that is required in a report is there, and you can do a complex report, in less than, under a minute. So you can imagine the type of efficiency gains that this type of technology can give, across specialities, really. So really want to sort of end this, talk really by saying that, it's been sort of 18 months since we launched Ognito into the Indian market. We actually have 87 enterprise customers already. And I believe that, we're just getting started. And it's actually a great tool to push EMR adoption, and really as a tool that can work very, very closely with these companies as well. So thank you very much, and really appreciate the time, and hope you enjoyed the presentation. Thank you.